Globalization has positive and negative effects on the world. The positives are the more available of healthcare technology that permits prevention of and cure of illness and diseases. Improvement in labor standards and wages in developing countries, which will allow more people to afford healthcare, and an increase in human rights all over the world and the use of various media outlets. The negatives are those that increase in the potential of spread of communicable diseases due to more international travel, change in lifestyles and cultures which impact diet and exercise levels, the reliance on motor vehicles for travel, increase in industrialization and population which impacts the climate, and differences between rich and the poor which affects the affordability of health care. International versus global. It's important that you understand that there is a difference. International health is concerned with two or more countries. An example would be an Ebola outbreak in Africa. Those two countries that it is affected work together, where global health is a multinational effort to address many health issues that cross many borders. A great example of this is the AIDS pandemic. These are positive impacts global trade and travel has on the world. Sharing ideas, technology innovations leading to improvement, such as clean drinking water, medications, treatment of acute and chronic health issues, better living standards for women and children, global stewardship, which are exchanges and information regarding global threats and opportunities, collaboration, societal justice, social justice and equality, and equity, progress in leading health indicators, child mortality, maternal mortality, immunization coverage, improvements, poverty, and disease. These are the negative impacts. Products imported from countries with lax safety and monitoring standards. For instance, food from China. They can be contaminated with banned drugs and toxic chemicals. Also, if toys are made in China, China still uses paint with lead. Brain drain. Growing disparity between the haves and have-nots, countries who have surged ahead and rewarded, and the countries who are behind with few or limited resources, which creates a wider gap. There's an increased overcrowding in urban areas, which then leads to increased health problems of obesity and chronic diseases, adoptions of an unhealthy lifestyle, and an increase in spread and infectious disease increased by global travel, such as the microbial hitchhikers of SARS, drug resistance, tuberculosis, bird flu, and Ebola. The global health issues that are life expectancy and mortality, women and children's health, communicable diseases, and non-communicable conditions. Life expectancy has a significant disparity in between high and low to moderate income countries. The same goes with mortality rates. Most of the child caregivers are women, therefore the health of the women and children are interrelated. Maternal mortality is high in many countries. Women are more vulnerable to the effects of poverty than men. This is due to the fact that they are less likely to work outside the home, and those that do earn an average of 40% less than men. Other factors that contribute to women and children's health are traditional roles place women at a higher risk to HIV infections due to the lack of insisting that the man use a condom, and there's an increase in violence against women, human trafficking, and forced being prostitutes, and the lack of vaccines to treat childhood diseases. Communicable diseases are changing patterns impact global health. Many of the changes are due to the increase of antibiotics, which is the cause of more antibiotic-resistant diseases, and also more zoonotic diseases. Many diseases that impact global health are HIV/AIDS, tuberculosis, and malaria. The non-communicable conditions are getting very close to passing the communicable diseases as a primary cause of death. The top 6 are coronary heart disease, stroke, COPD, cancers of the trachea, bronchus, and lungs, and diabetes. Other major impacts are that of the social determinants of health. Poverty affects health from reduced access to health care to inability to afford health care. Food and water impact health by there being more available with open markets, and then also to decreasing the local agricultural economies. Growing hunger is a result of the increase in world population and increasing cost of food. World population estimates are expected to increase by 50% to 9 billion people by 2050. Decreased availability of fresh drinking water impact health. Tobacco and alcohol control is the result of globalization of the tobacco trade, greater advertisements, economies of scale, and the ability of transnational companies to undermine local anti-tobacco regulations. Motor vehicle traffic has increased, cars and airplanes. The downside is that the road infrastructure has not kept up with the traffic. With more cars, people are not as active. There's an increase in fossil fuel consumption, which leads to an energy problem. There's an increase in motor vehicle accidents that also impacts health. Climate change have made a significant impact on population throughout the world. There are direct and indirect effects which have been discussed in the previous lectures. Immigration is on the rise, with people migrating to a better country with hopes of a better life. This is done legally and illegally. The migration can also be forced to be voluntary, forced due to wars or persecution, natural or environmental disasters. Sometimes the immigration occurs from developing countries to developed country. People may experience better opportunities but are also subjected to abuse and exploitation when they migrate to a different country. This is largely due to the unfamiliarity of a new country's law and customs, and they are at a greater risk of health problems and have less access to care. As in any industry, the nurses encounter clients from many different nations. Knowing more about the native country's health care will help in care provided to them and show the person respect. Health policy issues rise to the consciousness of those who make the policies. The important thing is to be a part of the many organizations and keep the health issues in the limelight to ensure the issues are addressed. Framing the issues as development issues tends to help. Utilizing health goods helps economies but also increase the availability of medication by allowing trade. Framing the health issue as a human rights also helps eliminate an issue. This is a complex and difficult process to go through, but is an option. Nurses can also support the international activities being involved in several agencies. Some of these are the International Council of Nurses, Sigma Theta Tau International, and GAINS, the Global Alliance for Leadership in Nursing Education and Science. If you haven't done so, I recommend you look at the case study on page 209 regarding this chapter.